everyone, I am Dr. Divya Bajpai. I am Associate Professor at CGS Medical College in KM Hospital, Mumbai. And today I talk to you on the behalf of social media team of ISMCon 2022, which is going to be taking place from 1st of December to 4th of December at Pune, India. So, as you know, we are holding this very interesting series of faculty interviews. And today, for this episode, I have with me none other than Dr. Agnes Fogo. Madam is a professor of renal pathology at the Vanderbilt University Medical Center, and she is also the director of renal and electron microscopy laboratory at the institute. Apart from her strong work in nephropathology, she also pioneers in the field of education and advocacy. She is a proud recipient of the prestigious Robert Narines Award from the American Society of Nephrology for the year 2021, and that was given for her substantial contributions in the field of leadership of educational resources. In 2021, she was also elected as the president of International Society of Nephrology for a 2-year term. It's an absolute pleasure to have you here, ma'am.
Thank you very much. I look forward to participating in the conference in Pune. In person, not virtual, which is a real treat.
Yes, ma'am. The pleasure is all ours. So, ma'am, while I was reading about all the work you had done, I was really intrigued to know why did you choose renal pathology in the first place? And over all these years, what drives your passion till date now in the field of renal pathology?
These are very good questions, Divya. I had a very influential teacher as a medical student who was a hematopathologist, and he would ask questions not for us to memorize things, but to understand mechanisms and to think. So he was very influential in me choosing pathology. His name was Dr. Robert Collins. When I was a pathology resident, I knew I wanted to do, since I was a child, something that involved research and academia. I was very fortunate that Dr. Ike Robinson, who was past president of the ISN, founding editor for Kidney International, and the vice chancellor of the medical center, recruited two extraordinarily talented people to lead adult and pediatric nephrology, Drs. Harry Jacobson and Dr. Iakuni Ichikawa. And they wanted to have somebody dedicated for renal pathology and research. And we had a wonderful diagnostician, Dr. Alan Glick, in our lab, but he wasn't really primed to be involved with research. So I was offered the opportunity to do a fellowship year that would encompass renal pathology and research. And I was so blown away by this opportunity that I veered away from what I thought I would do, hematopathology, following my mentor, Dr. Collins, and thought, working with such smart and enthusiastic and energetic people, I will be more stimulated and better educated no matter what I do. And it turned out to be fantastic. I've had wonderful mentors and opportunities within my department, other departments in Nashville. What keeps my passion going is the increased understanding I can have from looking at patients' kidney biopsies, the daily communications when I call back to nephrologists to discuss their patients' biopsies, not just the two-dimensional aspect of what I see in the slide, but putting it together, what led to this, what could happen, and then having the good fortune through mentorship and guidance to be able to write successful grants so that my experimental work, working with transgenic mice, some rats, some cell cultures, can allow me to probe some of the things that are very interesting. So this cross-fertilization, and then the joy of teaching the younger generation and having the light bulbs go up that people can get excited and understand better what they're doing, drive me every day to have a lot of fun. I'm very fortunate. I enjoy my job very much. Some days it's a little bit too much enjoyment. We all get a little bit too busy at times, but I really am in a wonderful place with wonderful mentors and leaders to make it possible for people to achieve goals. And I've been able to achieve many of my goals here at Vanderbilt, and also broadly within ISN and ASN and other societies.
That's so inspiring, ma'am. Actually, I would say the field of nephropathology has benefited much more after you have joined the field, thanks to all your contributions. So, ma'am, moving ahead, I know that you will be speaking on very intriguing topics at ISMCon 2022. And one of the topics is the targeted podocyte. And I was just reading that you have a paper also with the exact same title. So can you tell us what exactly you like? Give us a glimpse of what you'll be speaking and what we look forward to in that session.
That's a very tricky, broad question because the podocyte has been the central star for investigations in kidney disease for maybe the last, close to 20 years after Carl Tryggvason discovered the mutation variant in nephrin being causal in congenital nephrotic syndrome of Finnish type. It used to be, when I first started in nephropathology years ago, everybody cared about the mesangial cell. Then we cared about the endothelial cell, and then the podocyte has been the star cell that many people have been interested in. The podocyte is so interesting because it doesn't self-renew or undergo mitosis, and it is not just a passive barrier to escape of protein into the urine. It is metabolically active, it crosstalks with other cells, and it can be a primary or secondary target in many diseases. So I think that beyond the genetic diseases that directly can result in a Mendelian fashion in disease that is targeting the podocyte, we're beginning to understand risks that can put the podocyte at extra stress, since they cannot divide if the glomeruli grow very big, that we see with, for instance, diabetes or obesity, or compensatory growth when there is a loss of nephrons from any disease, but they get really, really stretched and can be stressed. There are, in addition to mechanical stresses and growth stresses, there are metabolic stresses, and there's crosstalk between the different cells that affects the podocyte. So I will be talking a bit about how we can look at the podocyte, both in culture, from patient data, from animal data. And then another lecture I'll be giving on progression of kidney disease. We'll talk a little bit more about the crosstalk of different elements within the kidney.
Yes, ma'am. Actually, we are looking forward to how you'll take the things from bench to bedside and all those animal data. How would you, would it translate to say practice changing things here? And talking about progression of CKD, that's a real big problem, and especially for us in low resource setting, where it is our best shot to say. Like we might not be able to provide care for end stage disease to everyone, but we can provide we can provide care to delay the progression. So talking about progression of CKD, you'll be discussing the mechanisms. How do you think this will be relevant to countries like India?
I think any insight that starts in a very highly developed country with a lot of resources, ideally, as the mission of the ISN, not the Indian Society of Nephrology, the International Society of Nephrology, is to bridge gaps and build capacity. We want these to trickle down so we don't just have esoteric, super expensive treatments that only apply to high resource settings. And of course, even within the US, of very high resource settings, there are many people who aren't covered by insurance, who don't have adequate access to all treatments that possibly could be offered. I think back over my time in nephrology, going from blood pressure treatment to understanding that RAS blockade could have additional benefits beyond blood pressure, going beyond RAS blockade and understanding that this has additional benefits beyond controlling systemic blood pressure to glomerular pressure, and then realizing all of the non-hemodynamic effects has become standard. And up until about 3-4 years ago, we hadn't had new breakthroughs. Now we have mineralocorticoid antagonists with finerenone. We have a class of SGLT2 inhibitors. We don't understand exactly how they work, but they certainly aren't working by just promoting glycosuria. They are working on some broad mechanisms related to progression of kidney disease. So our passion has been from our animal studies to understand that if we can intervene at an early to moderate stage of kidney disease, we could not just slow down the progressive scarring, we could actually reverse the scarring when we looked at animals over time. And now we have realized we cannot just be so glomerulocentric. We have to also focus on how the injured tubules affect the glomeruli, so that our vicious cycle of progression is not just damaged glomeruli causing more stress and injury on remaining nephrons of the glomeruli, but that the injured tubules can also have adverse crosstalk with the glomeruli. So we don't have a magic bullet, cheap, universally available treatment now, but my hope is that with insights on mechanisms and with new approaches and concepts going forth, that we'll be able to have treatments that can help. And of course, the most important thing is to try to prevent the disease in the first place. And that is maybe the most beneficial thing that we can do, is to increase awareness through programs like World Kidney Day and other programs, so that everybody can know their GFR, their creatinine, just like people usually know their blood pressure and cholesterol. And then we can intervene earlier, and maybe the treatments will be more accessible and be cheaper and will be affordable in all places of the world and accessible. These are my visions, both for the ISN, Indian Society of Nephrology, and for the ISN, International Society of Nephrology.
That's very interesting to know, ma'am. Like, you're talking about progression and also prevention in the same breath. Like, it's actually a dream come true, especially for people here in my country. Also, moving ahead, my next question is actually to the president of International Society of Nephrology. What is your advice to young budding nephrologists? As you will see, there will be lots of trainees and young nephrologists who are newly minted who will be attending this conference. So what is your advice to people like that, ma'am?
Well, it's very general life advice, I think. Life should be enjoyed. There are some things that are challenging and difficult, but we should be proud of ourselves for meeting those challenges, and we should feel supported. We should feel that we have the capacity to grow by meeting challenges, or if we can't quite meet the challenges, that we can learn from it and do better the next time. COVID has put extraordinary pressures on every level of every person, whether in healthcare or other areas. So to not give up your spirit, to not give up your enthusiasm, to be positive, to try to find mentors and surround yourself with people who are positive, and not dwell on the negatives to reinforce feelings of hopelessness and despair and inadequacy, but to look at what you're able to achieve despite all of these challenges and try to build an onward cycle upwards. Even though you can't achieve everything, even though things have been horribly challenging and so many moments of sadness, the fact that we are coming through this, and that despite all of this, there are positive things that have happened, to focus on the positive, to enjoy learning, to enjoy doing better when you can learn how to do better, to enjoy the things you already do well, and also to enjoy your life outside of medicine, to have a rich, fulfilling existence, and be proud that you can do so much and not dwell on the things that you cannot do so well. Of course, we should learn when we realize there's something we didn't do well and see how could I do it differently the next time. But I think bringing these things together and having a positive outlook helps us to deal very much more with challenges, even when the challenges are seemingly insurmountable. It helps a bit to look at what can be gained and what can be done, even in the most dire circumstances. And have fun. Life is wonderful. We should have fun, and we should be proud of what we can do.
Thank you. Thank you so much, Professor Fogo, for those wonderful words. I am sure after seeing this interview, especially lots of trainees will be looking forward to meeting you in person in Pune in December. So thank you, everyone. That was Dr. Agnes Fogo. She is very excited about her trip to India, and we are excited to welcome her here. Thank you so much, madam. Looking forward to meet you.
Thank you so very much, Divya. It was a pleasure to talk with you, and I look forward to seeing all of you in Pune in a few days.
Yes, definitely.